And a good friend of mine talked me into going into medicine, and I left after getting a PhD in chemistry and working for 5 years and went back to medical school. I didn't like the business environment as much. I wanted to be around people more, and into cardiology because I had some close friends who were in cardiology. It was sort of a merger between seeing patients on a daily basis and sort of doing procedures. I kind of liked both. The fun part of working in the cath lab is that patients come in at their worst. Nobody likes coming into the hospital at 1 o'clock in the morning. You know, I came in last night for an emergency, but then you come in, you meet somebody, and they're sick, and if you're not there, they might not be there. And then you form an instant bond with those patients. And in the end of the day, when you help somebody out, and you go up and you see them and now they're in recovery and they're doing great and they're kind of laughing when they weren't laughing an hour ago, that's very rewarding. And it makes it fun. When they come to my office, I always try to make people feel light. I don't introduce myself as Dr. Hedrick very often, only when it's appropriate and they need to know I'm the physician in the room. In the office, I always introduce myself usually by first name. And I think that's just my style. And not saying it's right or wrong, but I think my patients like that. People will gravitate to those people that are not just bright, but also they feel care. And I think one of the values of the Cleveland Clinic is that people do really care, from people helping people in the hallways to, you know, caregivers doing things in the room. I mean, we're all part of the same system.